All right. Hello, everyone.
Welcome. Let me do it. Yeah. Okay. Hello, everyone. Hello, and thank you for joining us, especially today on the International Book and Copyright Day. My name is Tonka Kostadinova. I'm a librarian at the Library and Information Center at the Medical University of Plovdiv. I am delighted to open today's webinar and welcome all of you. AMBOSS is an online learning platform, medical platform, which contains an interactive library interlinked with a QBank with clinical case-based questions used by students, physicians, and faculty in many countries. The students and lecturers at the Medical University of Plovdiv are also enabled to use this platform now within this 2-month trial organized by both our university and AMBOSS until the 15th of June. I am delighted to introduce our host today, Dr. Tanya Schrank. Dr. Schrank is one of the AMBOSS partnerships managers for Europe. He's from the United States of America, from Wisconsin, but he studied medicine at the Jagiellonian University in Krakow. He's now based in Krakow in Poland and continues to help improve medical education for students across Europe. Let me also welcome our moderator today, Ms. Margherita Massotti. Ms. Massotti comes from the beautiful city of Rome in Italy. She works alongside Dr. Schrank as an AMBOSS Partnerships Manager for Europe. She joined the team in 2019, and since then she's been supporting students and student associations across Europe. Now, without any further delays, let me pass the word to Dr. Schrank to start his presentation. Dr. Schrank, please.
Thank you.
Studying happens on your terms. Here's how you can create your own personal study plan in seconds with the AMBOSS Study Planner. First, the obvious stuff. Select the exam you're preparing for. Add your exam date. And select the kinds of questions you want to appear in your sessions. Now, here's where your plan really becomes yours. Think about your schedule. Is it kind of inconsistent? Not sure if you'll always be home by 6 on the dot? It's okay. You can choose the amount of time you want to study for in each session and on which days. And you're set. You've got your own customized study plan to keep you on track. Start it by going through the QBank sessions. At the end of each, you can review the session or take a look at the recommended articles. New QBank sessions will unlock as you go. At the end of every week, take a moment to dive into an analysis of each of your completed sessions. Create your own MBME shelf or USMLE study plan with the AMBOSS Study Planner at amboss.com. The AMBOSS add-on for Anki has been refreshed with...
All right. Thank you for that introduction. I am Dr. Tanner Schrank, as was said, and I'm an AMBOSS Partnerships Manager. So today I'm going to show you how AMBOSS works, how you can take full advantage of your access, and I'll show you some tips and tricks on the best ways to use it. Okay, so throughout the webinar, if you have any questions at all, please feel free to let us know in the chat, or if you come up with some questions afterwards, feel free to email us at hello@amboss.com, or you can email me directly at tls@amboss.com. Okay, and we'll have some polls running on the side as well, so that you can let us know what year of medical school you're in, or if you've heard of AMBOSS before, just so we can get a better feel for who we're talking to today. And if you want to follow along, then you can go to amboss.com, and if you haven't already made an account, you can make one there. But we also have a special page created just for students and faculty at the Medical University of Plovdiv, and we'll put a link to that in the chat. And if you go there, you can activate your access very easily by clicking Activate Now. You'll be taken to our website and you can create your account, and then this is how you activate it. So you go to your account access, and on the top you select your university, click this button, and then you will enter your email address that's attached to the school, and then click the button again, and then you should get a confirmation email so that you can click on that, and then you should have access to AMBOSS. Okay, so if there's any problems at all with any of that, let us know and we'll walk you through it. Otherwise, let's dive in and see what AMBOSS is all about. All right. So I have this little presentation prepared for you. It's like this, and then here's my email again if you have any questions. And so the design of the webinar is going to be what AMBOSS is, a walkthrough of it, and then questions and answers at the end if you have any. Okay, cool. So AMBOSS is basically an online medical education platform that's all in one. So if that's all you take away from this webinar, then that's enough for me. It's basically designed to make learning medicine easier and faster, and the end goal is to improve medical education for students and faculty. So on the left here on the slide, you can see how medical education sometimes is. This is how it was for me in Poland. This is how it was for the founders of AMBOSS. And a lot of times, all of the different resources you have, the textbooks and PDFs and notes, they're from different sources, so they don't always agree and align on the content. So when you're trying to gain a better understanding of something, you might end up more confused at the end than you were at the start. And so to get around that, to get away from that, the founders of AMBOSS decided to put everything in one. So it all starts with your study objective. So you set your goal, whether that's maybe an anatomy exam, or maybe you want to prepare for going on to the neurology ward. So you would set clinical neurology as your study objective. Or maybe you want to go to the US eventually and practice medicine, then you would select USMLE Step 1 or Step 2 exam as your goal. And then to prepare for your goal, you can read the articles in our knowledge library. And this is sort of like a digital textbook. So all of the content that you need to learn for medical school is going to be in there. And then to see if you actually learned anything, those are all interlinked with our question bank. So we have over 5,000 medical questions that are clinical case-based. So this means that they're not just memorization, they're more applying your knowledge. And they're multiple choice questions. And so you can work through these questions and you can fully customize your quizzes to really see if you learned from those articles. So you go from the library to the question bank, and then so that you can pinpoint where your weaknesses and strengths are, we have analytics tools. And so these help you plan and schedule your studying, as well as tell you what you're doing well on or poorly on. And so all of this is in one, and that is shown here. It's basically three different pillars of AMBOSS, I like to think of them as. So the knowledge library has the articles. We also have videos there, and we have clinical cases. So this is where you do your learning, and then to build your skills, like your exam skills or preparing to see patients, that's where the question bank comes in. And then to fine tune your studying and basically save you time by prioritizing what subjects you need to focus on, that's the analysis tools. So all of these put together, that makes AMBOSS. Okay, so why is AMBOSS unique? Why would you use it compared to any other resource? Well, besides the trial that you have going on right now, there's also some unique features and some special reasons to use AMBOSS. One student put it like this. So if you know what UpToDate and Osmosis are, this would make a lot of sense. UpToDate is a clinical medical prep tool for clinicians, and it's very clinician oriented. So it goes in depth on certain topics, and you need a subscription to access the information, but then you can see everything you ever wanted to know about very specific topics. But sometimes this isn't the best for students. And so at AMBOSS, we have a partnership with UpToDate, so we can take their clinical information and restructure it for students so that our content is more student focused. And then Osmosis, if you're aware of that, this is a really helpful medical education resource where they have handy videos. They're animated and fun and very memorable. And they also have test prep resources on their website. And so we have the Osmosis videos right inside our AMBOSS articles. So you can access the information from UpToDate, the videos from Osmosis, all within the same platform that you're already doing your studying on, which is AMBOSS. And then just like Wikipedia is constantly updated, it takes information from multiple sources, it's always asking for user feedback, AMBOSS is as well. So we have an international team of medical editors who crafts all of our articles and our questions, and these are constantly updated. And we also always list the references that we pull from at the end of our articles, so you can read up more about any topic. And on any part of the website, any question, any article, you can leave feedback for us so that we can improve these things for you. We can track down any problems and really make it improved. Okay, so that kind of sets AMBOSS apart. And now I mentioned the international team of medical editors. Well, that's one of the ways that our content is different. So our articles and questions are written and double-checked by medical professionals, and not just double-checked, but triple-checked as well. So you can really trust that the information you're getting is top-notch, and the quality is ensured by having it double-checked and then copy-edited and then triple-checked. And we also constantly update everything. So you can check the last time something was updated on the top of any article in the AMBOSS library. Okay. And then another way that AMBOSS is unique is that it actually works. So a lot of other test prep resources or medical education resources don't have the data to support whether they actually work. But this study showed that if students did enough questions on AMBOSS before taking these two big exams, so in this case, it's the United States Medical Licensing Exam, Step 1, which is basic sciences, and then Step 2, CK, is clinical knowledge. So students who did at least one question block scored 12 points higher than Step 1 national average, and then students who did at least half of the AMBOSS questions got 15 points higher than the national average for the clinical exam. So this shows that if you put in the work, if you do the AMBOSS questions, if you read the articles, you score higher. And I think that data is kind of speaks for itself. So that's one way that AMBOSS stands out. And I always put this slide in here because I really, really find it helpful, and not everyone finds it as helpful, I think. So I found out about AMBOSS in my third year of medical school. And after finding out about it, after becoming an ambassador, which is like a liaison between AMBOSS and the campus, and I'd like to welcome one of our ambassadors here. I see that she's here in the chat. Basically, after I became one of those, I didn't use any other test prep resources because I relied on AMBOSS for my studies. And one of the biggest advantages of AMBOSS that I really liked was the offline capabilities. So in my last year of medical school, I did international medical electives. So I went to Kenya and Scotland and Greece, and I didn't have mobile data on my phone in these places. And the Wi-Fi, of course, isn't great in these hospitals, in any hospital I've been in, but the AMBOSS apps on your phone allow you to download articles and questions to review offline. So of course you can access everything online. You can go to amboss.com, you can download the Knowledge Library app, you can get the question bank app, and you can do these on Wi-Fi or on data, but then you can download the article to read when you're in between classes, or you can download a custom quiz session to complete right before you go into a surgery or right when you're waiting for a class to start. And you can do these whenever it's convenient for you. And I found that really, really helpful. So I'd like to point that out to everyone. And so if you take some of these unique features, which I can expand on in just a minute, and then the high performance, like on the exams that I showed you, and put those together with the integration that AMBOSS is trying to do, where we interlink the knowledge library, the question bank, the analysis tools all in one, that's kind of what AMBOSS is and what makes it unique. And just to touch on the integration a little bit more, we also partner with other test prep resources outside of AMBOSS. So to improve your medical education, we have also partnered with Picmonic in the past. We did Boards and Beyond partnership in the past, and we have an Anki add-on. So if you use Anki flashcards, then you can download the AMBOSS Anki add-on, and then side by side with your flashcard, you get the AMBOSS article, and you can hover over medical terms and get the AMBOSS definition. You can read the AMBOSS articles right within the same program. So it really saves you a lot of time when you're studying and doing your flashcards. So I mentioned the apps. We can put a link in the chat to go and download the apps. We have a special page for you, but you can also just go to the App Store or the Google Play Store and download them there. And then I mentioned Anki. So this is a little clip of how the AMBOSS Anki add-on works. And we're constantly adding new features. So I think we're in version 2.0 now. So you should download that and check it out and see if it works for you. Okay. And we have a new special free self-assessment coming up as well. So this is handy for any students who want to go to the US eventually. It's called the AMBOSS USMLE Step 2 CK Self-Assessment Week. And so we had one for Step 1 recently, and now we're doing Step 2. And this is for any students who want to see if they're ready for the clinical exams. And it's totally free. You get a 3-digit score at the end to see how you stack up against other students. And you just need to sign up by May 2nd. So there's that. Okay, so now you know what AMBOSS is. You know what makes it special. Now let's see how it works. Maybe you don't know how to use AMBOSS. Well, if you break it up like this, you can see that we have the knowledge library with those articles and videos, and we also have clinical cases there too. So we try to cover all of medical school from day one until graduation and even beyond. So we have information for anatomy exams, for physiology, for when you're preparing for pharmacology, or we also have clinical stuff. So we have clinical skill videos in case you forgot how to auscultate the lungs, or if you're doing a neurological exam on a patient, we have a video on how to do that. And all of these are in the library. When you have access to AMBOSS, you get all of those in addition. So it's free. It's not paid extra to get the videos and cases. Okay. And speaking of videos, we have osmosis videos baked right into the articles. We also have Chalk Talk, which is our own AMBOSS in-house video series where we break down difficult concepts like ethanol metabolism and things like that. And this is in addition to the clinical skill videos. So we have a lot of content in there for you. And then that brings us to the question bank, where we have all these questions that you can fully customize. So whether you're preparing for an exam or you want to just prepare for a course and you want to be ready to see a patient, or you just want to study everything to prepare for general studies, you can do that in the question bank. And then we have clinical tips as well. So when you're answering questions, we have some helpful guides in the form of attending tips, which I can show you in just a minute. And then our analysis tools basically prioritizes what you need to study. It shows you much more than just whether you got a question right or wrong. It's more where your weaknesses are, where your strengths are, and what you should prioritize next. And I mentioned the Anki add-on. So let's check out the platform. All right, before we jump over to that, are there any questions? No? All right, then I will show you what the platform looks like here. So after you activate your account through the, I'm just going to put the link to this page that we have for your school in the chat. So go there and activate your access and then follow along with me. So once you log in, you'll be taken to your dashboard. Okay, here's my dashboard. And right away, you can jump right back into any studying you were already doing. Or if this is your first time on AMBOSS, you can just browse and check out what we have to offer. So on your dashboard, you have a study plan. If you've set one up, you can go into that and study following that plan, or you can read your recently viewed articles. You can redo an old question session you had. You can see how many questions you're getting right or wrong, and you can see how you stack up against other students with the same study objective. So I just set mine to the pediatrics exam, but you can set yours to anything. And if you want all of the questions, all of the articles to be relevant to you, then you should select General Studies. Okay? So let's just take a dive in here and look at the library. So in the library, we have those Chalk Talk videos I mentioned here, and we have the articles. So the articles in the library are broken down into kind of what medical school is broken down into, right? First couple of years would be basic sciences. Next couple of years would be clinical knowledge. And then when you're actually seeing patients, you're going to need your clinical skills. And then when you're actually in the wards, you want the clerkship survival guides. These go day by day and tell you what to expect in the psychiatry ward, and kind of gives you an inside look on what to be aware of when you're in those situations. And then I mentioned we cover everything from day one to graduation and beyond. Well, this is what I meant by that. So the on-call survival guide is designed for those freshly graduated physicians who just need a little help before getting back to their patients. So on the app on your phone, you can see the on-call survival guide at the click of a button, and then you can read about fever and then get back to your patient. And so it's designed to be very, very quickly accessible. But let's see, if we have basic sciences, then we can go to disciplines or systems. So you can organize things how you like. Let's go discipline, and then let's pick anatomy. Everyone needs to be prepared for anatomy, and let's see what we have. Why don't we go with, I usually do the liver or the gallbladder or the lungs. I think this time I'm going to go with, see what else we have in gastro. Let's go with the small intestine this time. So here we have an article. This is a kind of a short one, but you can see that it's set up kind of like a textbook, right? There's a table of contents on the side. So all of these different sections are linked. I could click on overview and it will open that up and highlight it for me. And you can expand or collapse any sections. There's a summary at the beginning, so you know what you're looking at. And then you can take notes right within the same platform. So up here, you can see there's a notes button. I could say, oh, I really need to study this for my exam. Bold that, save it, and now there's a little red dot that tells me I have saved notes on this article. Those are saved. I can come back to them whenever I want. I can even share them with other students at my school. So you can do all of your studying in one platform. And then right next to that, we have the feedback button, which I mentioned. So whether there's a typo or one of the guidelines hasn't been updated recently, or if you just love some section, you can let us know with the feedback button and we'll get back to you with any information on that. And then we can just scroll down and go through the article together. So first we get anatomy overview of the small intestine. And maybe this is too much information for you, for the exam, or for seeing your patients. So you just need the information that is definitely going to be on the exam. Highlight that information with our highlight button. And then you see in yellow the information that is usually tested or that you need to know for the clinic. In this case, it's clinical significance. And if this is still too much information, if you want to get through the articles quicker, then use the high yield button. This will trim all the extra information, and then you're only left with the high yield highlighted information. So you can get through your articles much, much faster. Okay. All right. Then right away we have a table, and we can maximize this table and look at it this way. So tables are really handy to organize your learning. And then for AMBOSS, we decided to make that a testing tool too. So once you're comfortable with the parts of the duodenum and the anatomy and embryological origin, then you can quiz yourself on that. So start a quiz, and then all the cells are blurred. You can click them to find out whether you really dedicated that information to memory or not. Okay? That's one handy tool that we built in. Finish the quiz and get back to the article. All right. Let's check out one of these pictures that we have here. This one is basically a diagram of the small intestine. Very handy. And like any good textbook, our images have captions. So you can read this short caption, or you can close that. And then sometimes you want to test yourself on images as well, just like the table. So you can turn off the indicators, and then you just have a blank small intestine. And then you could add the indicators, and then you have to add your own labels. So it's kind of like a pop quiz that you just made. And if you really want to test yourself, you can start a quiz, and then we will ask you what each section is named, right? So then you just answer and then go on to the next part. All right. So that's our table quiz and our image quiz. We can scroll down, we can see some actual clinical anatomy pictures. You can see our blue helpful hints here highlighted. And then we get to the microscope slides. So the microscopic anatomy is going to have things like electron micrographs, like this one. And the caption is pretty handy. It tells you what the white arrow is pointing at. And then what else do we have here? We have more images. I want to see this microscopic slide. So this one looks great. We can see the tissue very up close, but maybe we're not quite sure what we're looking at. Maybe the caption isn't super handy. So let's turn on the overlay function. And now everything is color-coded and labeled with different lines, different letters, and we can really see exactly what we should be paying attention to. Okay? So the overlay function is going to be very helpful for microscope slides, for radiology, so x-rays, ultrasounds, MRIs. And I think the overlay is probably one of the best features of AMBOSS, so definitely give that, check that out. And then if we keep scrolling down, we see clinical significance, and then at the bottom we have references. So this is a very short article. There's only 3 references, but you'll recognize some of the names, right? Gray's Anatomy is in there, and then we have some medical journal articles listed. So we take information from everywhere we can. But let's go check out a different article that has a lot more references. So pneumonia is one of my favorite articles. It is full of information. Let's just jump right down to the references right away. So you can see that they go on and on and on because we're constantly updating this article. We have more and more information that we're adding, and you can see the different kinds of information, right? We have up-to-date listed here. Like I said, there's the CDC, there's internal medicine textbook, there's those medical journal articles, and we also cross-reference things with your other test prep resources as well. So you might see some familiar names on here as well. So that's our references section. And then if we go back up we can see some extra features here that weren't on the other one, the other article. Here's an overlay of the X-ray. Very helpful to see. We have clinical images as well, like this, little diagrams for you. And I wanted to show you a very cool feature with microscope slides that wasn't on the other one. And that is, as we scroll past all the clinical treatment calculators for pneumonia risk and all the different X-rays for pneumonia, let's just take a look at one of those. You can see the overlay is very helpful there. But I want to get to the microscope slides. Okay, we have to go past the clinical skill video. This is about how to auscultate the lungs. You can click that and it plays within the same tab in your browser. And then eventually we'll get to the, nope, we won't find it. Well, there's an osmosis video as well. So you can watch those in your browser too, just like I said. And it has to be here somewhere. Maybe we'll go to a different article. Why not? You can search for any article you want. And let's find the liver. So there's this really, really cool function that I want to show you, and it's called Smart Zoom, because I know how hard histology is and pathology. And when you have these slides, I know they can be very intricate. There's lots of detail here, right? And with this one, there's a caption, but maybe you want to zoom in on this portal triad. You want to see what's going on in here. So you try to zoom in on the browser and it's blurry, right? It does not look good because it's just an image and we're just zooming in on the image. But if we turn on the smart zoom, then it's just like a microscope slide. So every increase in magnification refreshes the resolution. So you can really dig deep and see what is going on in this slide, and you don't lose any of that detail. So this is what I really, really wanted to show you, because I think it's so helpful to see these tiny little details that you don't get in the other by just zooming on your browser. Okay, there we go. So taking a look at the poll, it looks like most of the people here are 3rd, 4th, and 5th year. Okay, so around the middle of your education, just getting into the clinic. So you're covering more specialties like pediatrics, OBGYN, things like that. Okay, very good to know. So let's go ahead and take a look at some questions. So here we've looked at the liver. We marked it as learned, so it's saved in a list of studied articles on my phone in the app, and I can start a question session on this. But I'm reminded that it's not relevant for my study objective. So this is very important to keep in mind. You don't want to be wasting your time studying something that is important, but not immediately important for the clerkship you're on or the exam that's coming up or what patients you're going to see. So it warned me that I can go ahead and make this quiz, but maybe I should look at a different article. So what am I studying? Did I say pediatrics? So let's try, why don't we try chickenpox? And if we try to make a question session now, it will tell us that my study goal matches. I can choose what kinds of questions I want, new ones, ones I got wrong, ones I needed help with, or all questions. And then I can choose how many I want. So I'm going to do 8. And I can further refine this, or I can just start. And if I've done questions on this before, I would see a little progress bar here that tells me how many I've gotten right or wrong or needed help with. And just for 1 second, let's go back to the pneumonia article, because I've done questions on this. See, I've done 33 questions on pneumonia, and I've gotten a lot of them wrong, which is good. That means I'm learning from my mistakes. So if I turn on the learning radar, then I can see what parts I need to study to get those questions right. So they'll be underlined in red. So you can tell I need to do more questions and read up more on community-acquired pneumonia, specifically Mycoplasma pneumonia. So I should spend my time studying that and not the viruses that cause atypical pneumonia. So that kind of helps you hone in on what are your weaknesses. And that will stay underlined in red until you get those questions right. So this really has you studying your weak points. Okay, let's go back to chickenpox. And we can start a question session. And now we've gone from the knowledge library article to the question bank custom quiz with just a click of a button. And it's in the same platform, in the same tab, so it should save you some time. Now, as we look at this question together, we can increase the font size, and then we can break it down. So all of our questions, you'll notice right away, are vignette style. This means they're designed like the NBME, USMLE, PLAB, all these big international exams are designed. So they're clinical oriented. So it's about the patient coming in to see you. It's not about memorizing an enzyme or remembering the most common kind of cancer. It's about what this 4-year-old boy is concerned about, why he's in pain, what you can do to help. So as we take a look at this vignette, we can highlight the important parts. So maybe his demographic information, maybe his chief concern. So there's a rash on his hands and feet, and maybe how itchy it is at night. He has not had these symptoms, and maybe in the end, we're going to highlight everything. So a lot of early students, first and second years, wind up highlighting everything. I did this too, because you haven't really sorted out what's important for the question yet. So to help with that, we have the key info button. This will underline in green what you need to know for this question specifically. So intensely pruritic, especially at night, maculopapular rash, linear patterns affecting the interdigital spaces. Okay, so there's a lot of pediatric rashes out there, right? And this should help us sort of navigate our differential diagnosis. So we should be ruling some out and ruling some in, and then we can take a look at the actual questions. The lead-in is, which of the following is the most effective intervention for this patient's skin lesion? Notice that they don't want to know what the lesion is, so this is what we call a hinge question. You have to figure something out first, and then you have to answer a different question. So you need to know what is the cause, and then what you treat it with. So if we're sure that it's not one of these, we're sure that we don't need to give oral acyclovir, we can rule it out with this X on the side, and we can just take a guess if we don't know. So let's try clotrimazole. This is incorrect, but the beauty of AMBOSS is that you get to try again. So you answer the question wrong, you can read why that answer is incorrect, and then you find out some more information. So our attending tip automatically opened up. This is designed to sort of replicate what it's like to have an attending physician next to you, asking you questions about a patient or pushing you towards getting questions right on your own. So they're not going to give away the answer. And so that's what we're doing here. We tell you that this patient's rash is likely a local inflammatory reaction to burrowing within the skin. Now, with that information, you should be able to figure out what the illness is, and then with that, what the treatment is. If we can't figure it out, then we can keep guessing incorrectly, and we can, every time we get it wrong, right? Maybe we think it's all of these wrong answers. That's totally fine, because we're in study mode and the AMBOSS questions are designed to be extra hard. So just to prepare you for anything that's thrown at you, we make the questions even more difficult than the exam or than what you're going to see on the wards, because we really want you to be prepared. So when we finally get this answer right, it's permethrin, really scabies. Then we find out why it's right. You can read up on that. You can look at the image. You can read additional information. And you see these little percentages next to the answer options. That tells you how many other students are selecting that answer. So if 77% are getting it right, that tells me it's on the easier end, right? And to just double check that, you can look at the list of questions on the left here. All of our questions are ranked for difficulty from 1 to 5 hammers. This one is 2, so it's on the easy end. When you get a 5 hammer question, you will definitely know it. Okay, so this one, if we're not sure where we should have learned this information, maybe we don't remember reading this in the scabies article, you can click on the link, and then the article and the question will be side by side. It will scroll down, and then you can see highlighted in green exactly what you need to know to answer the question. Okay. And if you really like this question, you can save it to a folder and then make a custom session with this later. And educators can also use this. So if you want to collect some questions together and have your students answer these specifically, you can do the same thing. Okay, so I made a folder called rashes, and now I can make a quiz on it later. All right, now we can go to the next question. And here we have some lab values, right? If we want to check what a normal lab value is, just hit labs, scroll down, find the reference range and the normal value, compare it to these, and then we're set. Close that, get back to the question. All right, so we can go ahead and answer all of these, or we can just skip them. And you'll see in the end, when we get to the 8 questions, we have an option. So we can see our analysis right here. Instead of next question, it says see analysis. So if we click that, we're taken to the analytics tools. So we've gone from the library to the question bank to the analysis, all in the same platform. And now we can see how many questions we did, how long it took us per question, and then what % we got right, and how we compare to other students with the same study objective. And the best part, study recommendations. So this is where we tell you what to prioritize. You can see there's meningitis is top priority, and then scabies is lower priority. So I got that one wrong, if you remember, but it says there's only one question on it on the exam. So I don't have to worry about that too much. I should spend my time on meningitis. It's a much more dire illness, and there's more questions on it. So I can do the same thing with disciplines or systems, and I can make a question bank session on any of these. I can read why it's prioritized by clicking on it, and I can even look at all of my studying together. So this is just my most recent session. I can go over here, click on study summary, and then see all the questions I've done. And then my overall recommendations are here. Okay, so there's that. We've gone through the library, the question bank, the analysis. Now let's say you want to make a question session not based on one article. Go to QBank, create a question session, pick what kinds of exam you're preparing for, maybe all of them. Choose the systems and disciplines. So maybe just the skin, what discipline. Maybe you want emergencies for skin, and then you can go by symptoms, by articles. You can see those saved question folders from earlier, and then you can choose what difficulty you want. So I like to do 1 through 3 hammers, so I don't get too discouraged by getting so many wrong, and then go by status. So I could do new questions or ones I got wrong, or for those that I used key info, overlay, attending tip, and then got it right, those are considered correct with help. So that's what these are. Okay, I can even do just questions with pictures if I wanted, and then I can name it, and then I can choose how many questions I want, from 1 to 1,000. So I'm going to just leave it at 14, and I could do study mode again, or I can try exam mode. So exam mode is going to show you what it's like to take one of these big international exams. So you got the blue screen, you can still do lab values and notes, you can still highlight, but you don't get the attending tip. You don't get key info. There's no overlay. And when you answer a question, you can only find out if it's right or wrong at the very end of the session. You can't see if you got it right or wrong right away. Okay? So this is designed to get you really prepared for the exam. And that, I think, is the best way to actually study for the test, is to practice taking the test. So once you study enough of the articles, do enough of the questions that you know you remember the information, then see if you can actually take the exam by doing exam mode. And then you can end the block and then go back to this study analysis just like before. And we'll see how many I got right out of those 3. While we wait for this to load. Oh, there it goes. I'm going to check this chat. Looks like Margarita is taking care of your questions. So there's a question about studying multiple disciplines at once. So you can only have one study objective at a time, but you can set your question bank session on whatever you want to study at the moment. So it doesn't have to match your study objective. So the example was pediatrics and gastro. I can do that here. So let's do just pediatrics, and then let's do systems, gastroenterology, and then we have all of the questions available for us. There's 56 for specifically gastro in pediatrics, or you could do just gastrointestinal system, and that's 474 questions. So you can do it either of those ways. So I hope that answers that question. And let's see what else we have. So if you want to prepare for your exams or prepare for seeing patients, sometimes it's hard to schedule or organize your studying. And for that, we have study plans. With this, you can look at what we suggest you cover so that you're prepared. So let's say I have gastroenterology coming up. I want to know what to study for that, so I'm ready. So we have it all laid out for you here. Spend 40 to 60 minutes on the basics. There's 3 articles and 1 question. That will be marked green when you're all done. And then you can move on to chief complaints or concerns for gastroenterology. And you can click on that and see what there is. I've already learned one of the articles, and this helps you organize your studying. And then once you answer the questions, you can see your analysis here. But let's say you want a more custom study plan. For that, you can use our new custom study plan tool. So create a study plan, tell us what exam you're preparing for, or what subject you want to be ready for. So let's say I have an emergency rotation coming up. I'll just pick emergency medicine. And that starts in the middle of May. So May 15th, 2021. Choose what kinds of questions you want. I want all of them. And then tell us how much you can study. So how many days and how much per day. We recommend 2.5 hours, 4 days a week to be prepared by that date. But maybe I can only do weekdays for an hour. Then I'm only covering 48% of the content. So I could go ahead and make that plan, and then AMBOSS will give me the highest yield questions. So I'm ready for the really important things, but I don't spend so much time on the ones that I might not even see on the exam or while I'm in the ward. Or I can just up my studying per day, and then I'll cover more content and maybe be ready. So come on, 2.5 hours. I'm ready by May 12th. Okay. So if I create the plan, I can see week to week what I need to cover. Here I see there's 47 questions this week. If I start that, it takes me right to the question bank, and I'm already doing the questions. Okay. So there's that. Anything else? I want to show you the clinical stuff because we have so many students in 5th year and higher years. So under clinical skills, you're going to find these clinical cases. If you look at case 1, you see abdominal pain, and this is designed to be doable, but with one mock physician, one mock patient, and you just go through the checklist covering all of the history and physical for this patient, right? And it asks all the important questions, right? What's your chief concern? How bad is the pain? All of this. And then there's videos if you forgot how to do an examination of the abdomen. And then at the end, there's a patient note you can practice writing. This is really handy to practice your patient note skills. So, what was it? 19-year-old woman sent to the emergency department, blah, blah, blah. You can write the physical exam. You can write the history and physical findings, match them to a diagnosis. Then you have a differential, and then come up with diagnostic studies. So maybe she needs ERCP, maybe just an X-ray. And then submit it, and you will find the AMBOSS suggestion for the patient note. So this really helps you see what you should have been writing. And I think in my med school, we didn't get that much practice with this. So it's really helpful. If it's not covered in your school, then you can practice on your own. All right, close that, get back to the article. And at the bottom of the case, there's a differential with more links you can find out. Okay, so we looked at study plans, the library, the question bank, the analysis. Are there any other questions right now? No? Someone asked if this is a recorded webinar. Yes, you can rewatch any of it at the same link you followed to get here today. And what else? Anything related to online clinical simulation? Yes, I hope that I just showed you some of that with the clinical skills. Margarita mentioned more about that. And anything else? Okay. So some people are asking about articles versus textbooks. I mean, every class that I had its own textbook, and I found that the AMBOSS information covered what was in the textbook, and it prepared me for my exams. Of course, textbooks are always going to be required by instructors, because then you can sort of make sure that everyone's covering the same curriculum. But in concerning whether you should get a certain test prep resource or a medical education resource, I would say AMBOSS is helpful, if not I don't think it replaces all textbooks. I think it's more of a supplement. But if your personal experience is different, then by all means, try out AMBOSS with your textbooks and see if it's necessary. Awo asks, are the articles based on NICE guidelines? So the AMBOSS platform, it was originally made in German. It started in Germany, and that was based on the German European guidelines. And then when we started the English version, we used US guidelines. So that's why at the bottom, you'll see CDC as a resource. You'll see USMLE as a study plan. So you can use it to prepare for UK exams and going to the UK eventually. But just know that the NICE guidelines, as they're called for the UK, those aren't strictly followed on here. You can look up the conversions for yourself, but that's just something to keep in mind. All right. We have another poll up, and it looks like most people have a problem with too much information in med school. I know, I had the same thing, and that's why study plans come in handy. So they help you organize and schedule your learning. We have a question about the German version. Great question. The two platforms are completely separate. So they're built on different guidelines. So access to one does not give you access to the other one, unfortunately. All right. I also wanted to show you there's a special page to download the apps. There's the Anki add-on. You can go here and download that. And here's the Step 2 CK self-assessment. I'll put those links in the chat. Any other questions at this time? Let's get back to the presentation just to finish that up. So if you come up with any questions later, feel free to email us. Here's my email once again. Here's the Step 2 CK self-assessment and the apps. So you can download them, and the Anki add-on. I think I'm already in there. Yes, Margarita already placed that one in there. Great, thank you. Okay, time's running out. We have one more question. If you have any more questions, please let us know. Gibran asks if you should read through the second most common answer or all of them. I personally would look at every answer, whether it's right or wrong, because every single answer tells you why that one's right and why it's wrong. You learn by getting it right, by getting it wrong. So definitely read through the second most common, if not all of them. Yeah. All right. Any other questions? Okay. Well, if you have any other questions, please feel free to email us. Definitely go and give it a shot. Try the trial since you have it. And is there anything else to add?
I just wanted to say thank you, Dr. Strank. If this is the end of the demonstration, thank you for this demonstration. Today was really very interesting and informative for our students and for the lecturers as well. I hope they all enjoyed exploring AMBOSS. Well, I'd like to say thank you to everyone who joined this session today. Have a great day.
Great. Thank you so much. Bye, everyone.
Bye.